So the purpose of thirst is to tell our body that we need water, of course, right? Because our body doesn't want to be dehydrated. What can happen during dehydration is we, like I said earlier, if we don't have enough bodily water, that means our blood volume is lower, right? So what can happen is our blood pressure will decrease. We're going to be putting out less volume with our heart. We're going to have a decreased cardiac output. Remember how important the blood is for oxygen to be transported and for nutrients to be transported to the nutrients to be transported to the tissues. And remember, water is the solvent for all of that, right? And it's in our blood. So if our blood pressure is lower, our cardiac output's lower, our blood volume's lower, that means we're not going to be able to transport all of these necessary nutrients, all of this oxygen to the rest of the body. And it can even be deadly, dehydration. And that's why we've seen, kids or athletes dying like on football fields and things like that from dehydration. They can have strokes. Their body temperature can get so hot because they're not able to create sweat because they're so dehydrated their body can't spare it. So dehydration is a huge, especially in today's world, a huge concept that we're reforming and how we treat hydration, especially in athletes. And that's why refueling and rehydrating during and after exercise is so important, especially for sports dietitians to learn and practice. So these are some signs of dehydration, whether it be mild dehydration or moderate to severe dehydration. You would probably see this often in a clinical practice, just with a patient lying in a bed. A lot of times patients are going to have IV fluids running, so hopefully they wouldn't be dehydrated, or they're going to be eating and drinking well, but it certainly can happen, especially among like your tube feeding patients if they're not giving enough fluid between their feedings. So one issue regarding dehydration is among dehydration in infants. So like I said earlier, infants don't have as high of a body weight, so they lose their body weight, or they lose a higher proportion of their body weight daily through just regular water losses. So in infants, having diarrhea are one of the leading causes of death from dehydration in the world for infants. So a lot of times oral rehydration solutions are utilized. Think of this as like Pedialyte, and they have like liquid IV and other things like that that can be used. So you might have heard of being water intoxicated. This can happen if you're drinking a ton of water, or you're having a very high infusion rate of IV fluids. Typically our body, especially our kidneys, should be able to cooperate with a high water intake, and we shouldn't have issues with it. But if, consumed in extreme amounts, we could have an excessive water intake that could be life-threatening, or at least cause us some issues. So another important factor when talking about water is edema. And basically what this is that accumulation of water in our interstitial spaces. So rather than it being in our cells, it's between all of those. And we talked a little bit about how malnutrition can affect this. But also, kidney disease and heart failure, even inflammation, can cause this edema. So you have an activity this week that you'll do, which will help you understand how edema happens and how you as a dietitian would work with a patient who has edema. Most often you'll see this in patients with kidney disease or congestive heart failure, or patients who are severely malnourished. So this is something you'll learn how to do with your nutrition-focused physical assessment in your assessment classes or MNT. And that'll give you some hands-on experience in how you describe like pitting edema versus edema. Okay, so you're going to also answer this question on how edema and heart failure are related. So